Welcome.
Thank you. Thank you. Hi, everybody. Thank you for inviting me today. I am very excited to talk about neuromarketing. Some of the things I'm going to talk about today, you've actually heard in the presentation, but I'm going to repeat it. So next slide, please. So this is what you can expect from today's presentation. Next slide. So what is neuromarketing? So neuromarketing is the study of neural activity and physiological activity. So what does that exactly mean? So neural is anything in the brain activity. And of course, physiological is anything outside the brain. So you could be in a closed room tracking the carbon dioxide levels in the room. You can do eye tracking, tracking the facial muscles, things like that. And why are we doing that? So that we can get a very honest and transparent look at how a consumer feels about advertising, creativity, products, and pricing. So it's very important. And why do we care? Because it circumvents the problem of relying on the consumer's self-report. Next slide, please. So question, can the science of neuromarketing achieve reliability and fairness without addressing diversity, lab transparency, cooperation, and standardization? It's a big question. So let's jump in. Next slide. So yeah, this is a super busy slide. But this kind of shows my process of when I started doing neuromarketing research, I was like, what is this? I'm obsessed with the brain and I've done marketing a very long time. So I came up with a much longer timeline, but in my opinion, it goes way back to Alcmaeon of Croton, a philosopher, in around 460 BC, and he linked the brain to thought and sensation. Jump ahead to 1849, electrical activity in human skin was discovered. 1878, electrical activity in the brain was discovered. In 1898, the first eye tracker was created. We care about these things because these are some of our tools that we use today for neuromarketing. 1924, EEG was invented. Formal AI was created in 1956. 1964, Herbert Krugman used pupil dilation, and then in 1971, used EEG to measure consumer interest in ads. 1976, fax was developed to measure and analyze facial expressions. 1990, fMRI invented. In 1999, ZMED based on fMRI was developed to explore the subconscious consumer response. Sounds a little mysterious, but it's super cool. And 2002, the term neuromarketing was created, kind of made it official. 2004, a big study was done with fMRI, looking at Coca-Cola versus Pepsi on how branding influences brain activity and perception. And then today, 2018 to present, which was when I first started the research about 2 years ago, in the United States has been a leader in neuromarketing, and for the most part, it was like starting in a couple of different agencies in the United States. Big corporations started to understand the value, and then it moved quickly in-house to these in-house science labs in the large corporations. Next slide, please. So just a step back to look at the most common neuromarketing tools. Brain activity, we're looking at EEG and the fMRI. And then for the physiological activity, again, outside the brain, common is eye tracking tool, which I believe we're using here in BU, and FEMG. Next slide, please. Yeah. So AI is widely used as a secondary tool in a lot of science. Neuromarketing is one of them. Definitely helps with analyzing large data sets, making testing more efficient in terms of cost, time, and accuracy. So let's get into the ethical gaps and challenges. First, we're going to look at the methods and the results. So like I said a few minutes ago, what's happened with neuromarketing, it has gone in-house with large corporations. So keeping that in mind, let's start on the lower left side, looking at funding bias. So if the labs, for the most part, are in large corporations and they're also funding that research, then there's funding bias. Go up to data translation gaps. This is what goes on. You have a lab who's doing some legit studies. Black and white data is pulled from that study. Then it goes to the marketing department. And marketing then has to turn it into a bit of a story in a way to explain it either to the consumer or to senior management. And then senior management decides what they're going to do with it, either internally or externally being with a consumer. So it's a little bit of grapevine, like, is the story the same as when the scientists actually pulled that original data? So it's a translation gap, most likely. And then again, the same concept of corporations going in-house. There's no standardized oversight. You have company A, company B, for example, they don't want to share data because this is how they think that they're remaining competitive. So there's no standardized oversight. There's a lack of transparency and cooperation because again, company A and company B don't want to share information. They think that what they've learned is going to put them ahead. And then we have a possible test subject alignment concerns. This is, who are these test subjects? Do they align with the actual study? Do they actually align with the present day and future day goals of the large corporation? And then we have a risk of scientific racism. Next slide, please. So jumping into the bias and lack of diversity of test subjects, I would argue that this is a problem across a lot of science, and definitely in neuromarketing, it's going to be a huge issue. So weird population limitations. So weird is Western, educated, industrialized, rich, and democratic test subjects are the majority of the test subjects that are used. So white and middle class, basically. So the impact is that neuromarketing insights may fail in non-weird contexts, skewing global strategies. Then we have the issue of socioeconomic status. Is that being taken into account with the test subjects? If not, the impact is SES differences may result in hidden behavioral variations. Then we have social exclusion and neural responses, racism that occurs, and the impact on that is that neuromarketing methods risk overlooking unique racial experiences tied to social dynamics. And then, of course, the risk of scientific racism. The impact is neurobiological research in AI systems may and present day do perpetuate stereotypes. So what are the ethical implications? So we're looking at flawed data interpretation. The impact is a misrepresentation of consumer behavior. We have ethical concerns, which compromises the trustworthiness of results. We have restricted applicability, which bias strategies alienate and fail to develop diverse consumer groups. We have stereotype reinforcement that marginalizes communities and overlooks potential markets. And in line with entrepreneurship and really how you remain competitive is all about innovation. There are barriers there based on the test subjects or a lack thereof, the diversity, and it limits the development of inclusive and groundbreaking marketing strategies. Next slide. So recommendations: implement standardized oversight, promote transparency, encourage global collaboration to establish best practices and openly share findings, expand test sampling diversity, train researchers on implicit bias, develop and train AI systems to ensure that algorithms do not reproduce racial or socioeconomic biases. I know that it was discussed earlier today. That's a very tricky one, but it should be the goal. Next slide. The conclusion is by adopting transparent, standardized, and inclusive practices, neuromarketing, a promising marketing research tool, can evolve into a valid resource that effectively serves global diverse populations. I would add one more thing on top of that based on my learnings today from other research, is that as neuromarketing tools become more affordable, not just the large corporations, but smaller businesses and agencies can use it, then they can remain competitive in the marketing sphere. When you have data behind you, you can present all sorts of ideas to large corporations and do some good stuff. So next slide. Research and design methods follows a systemic review design findings from secondary sources that are listed there. Employed a mixed methods approach, examining both qualitative and quantitative data. Next slide. Q&A. Thank you. I guess I'm ready for you.
Now for me, audience, any questions?
Oh, yeah.
So actually from me,
Yes, because of the recordings.
yes. So I was actually wondering if, so I know there's market research firms in existence. Do you think they already started having a dedicated section of that company solely for neuromarket research? And do you think having that more standardization in the industry will be a good step towards this goal of standardizing neuromarketing practices across the board?
Well, I think I'm a little obsessed about neuromarketing, so I say everybody should be using it. So market research, yes, absolutely, that would be amazing. Are they all doing it? I don't know. I would have to do some research. Marcus might have some insight on that. But should it all be standardized? Absolutely. And we know in the scientific community for other topics, other research, there's a lot of cooperation and we all make each other better through cooperation. So there are some universities that are doing neuromarketing research. You know, BU is, you know, hopefully going to be jumping into that, and we can do ours and start to lead in this as well. And we can be darn sure we're going to be cooperating and standardizing.
Thank you so much.
Of course. Thank you.
Thank you. Yes, I guess I know the answer to this question, but it has been quite some time. What drives your research in neuromarketing? Why are you interested in neuromarketing? I know you are a marketing practitioner.
Yeah.
Why did you the jump into neuromarketing?
Well, this is actually a funny story, and it's a BU Med story. So I got my master's here at BU Med and in global marketing management. And anybody who's in that program knows you have to take a finance and accounting course. And that is actually not my forte. So I actually started jumping into brain research to see how I could manage my brain and learn differently so I could pass the class. I'm happy to tell you I passed the class. I got my degree. But in the process, I got really kind of like, I don't know, I was so interested in neuroscience, had Dr. Gonsalves was my professor in a couple of classes, had a conversation, and I was like, wouldn't it be a great world if neuroscience could be combined with marketing? And he's like, that exists, and it's called neuromarketing. I'm like, oh my God. So I was so happy to jump in and do this research. This research is a reflection of me not knowing anything about it. So I was like, that's why you see the origins of my perception of the origins, my kind of thorough study of the arena of neuromarketing. But as an entrepreneur myself, and being very innovative in a lot of the things I've done over the years, neuromarketing is such an amazing way of getting closer to the consumer, their experience, hopefully in a cheaper way than like focus groups or 1,000 people across the country or the world, and really coming to some conclusions and creating products and services that actually will make a difference. So from point A to point Z, I'm like all in. So I love it.
Thank you. And yes, I think she's the only student that has approached me in my tenure here at BU and asked to do this research. So we actually did an independent study. We exchanged a course for a full semester study that she did on her own, which was an excellent study. And I think that catapulted you to what you're doing now.
Yes, absolutely.
Which I appreciate very much your research.
Yeah.
She has intimidated some people at BU here. I was there to witness.
What are you talking about?
Let's not say names.
Yeah, that's a whole other, yeah.
Let's not say names, but so that means you're on the right track. I commend you and I encourage you to continue to charter that path.
Yes.
Thank you very much.
Thank you.
Congratulations.